Hello everyone, I am Dr. Pawan Gupta. Today we will be discussing a case of IOL exchange where a multifocal lens will be exchanged with EDOF or eye-enhanced lens, and this patient underwent a cataract surgery roughly 6 months back, and a panoptics lens was implanted and she was having lot of glare, so she decided to get a lens exchange. So now this is first we are trying to disengage the lens as surgery is 6 month old. So we are trying to separate the lens from the capsular adhesions. And here we are using a fine spatula to separate the lens from the capsule. And as you see, it is firmly adherent. So here I am lifting the capsule with the help of a spatula, and then with the help of Sinsky hook, I'm just trying if we can release the haptic, but it is firmly adherent. So you can see how firmly it is adherent to the capsule. So now here I am lifting the optic of the lens, and I will be injecting viscoelastic in between the optic and the capsule so that at least optic is separated, and be making another attempt to release the haptic, but it is very firmly adherent as surgery is roughly 6 months old. So I'm just trying with the help of the spatula to release the adhesions of the capsule from the haptic, filling the eye with the viscoelastic again, and just making another attempt to release the haptic, and before that just trying to separate the adhesions, but this haptic is very firmly adherent. See, it is pulling the bag along with it, very firmly adherent. So we thought that let us release the another haptic first, and then with the help of the rotatory or the circular movement we will release this haptic. So now I am separating the capsular adhesions again so that we can release the second haptic. So now see, this haptic is also very firmly adherent and it is pulling the capsule. See, it is pulling the capsule along. So here what we will do is that with the help of a Y pusher, we will try and give a support to the capsule, and then we will pull the haptic. So now this one haptic is released. Now with the help of the circulatory, or like we do that, we will release the second haptic. So now the lens is free, and now with good lens holding, intraocular lens holding forceps, I am holding the lens, and gradually we will rotate the lens and give a gentle pull, and this lens folds in the section and it just comes out. It is there is no need to cut the lens, and I am just checking that the capsular adhesions are released, and then we will be implanting an EDOF lens. So the most important or the difficult part of the surgery is to release the lens from the capsular adhesions. because as your surgery get old, these adhesions became more firm. And once it is the capsule is released, you can pull out the lens. And now we are just, after removing the viscoelastic, we are hydrating the sections, and our surgery is complete.